Good evening, everyone, and welcome to the opening kickoff of the Fellowship Zoom Room series. My name is Lauren Christie, your moderator for tonight. As a reminder, before we get started, all of this information that will be covered will be posted on the American College of Foot and Ankle Surgery Fellowship website page. Additionally, look out for a post-communication email with contact information for if you have any questions or concerns for the respective fellowships. We'll also have two additional Zoom rooms in the following weeks to come. Throughout the night, if you have any questions or concerns, please feel free to ask in the question and answers. To kick things off, we'll have Dr. Ronald Troxell from Advent Health Foot and Ankle Surgery Fellowship. Dr. Troxell?
All right, thank you. I'm going to go ahead and share my screen here. I got a few slides to discuss our program. Can everybody see that?
Not quite
Yeah.
yet. There we go. Perfect.
There we go. All right, perfect. Thank you guys. So, first, thanks to the college for having me on here. My name is Dr. Ronald Troxell, and I'm the fellowship director of the Advent Health Innovative Foot and Ankle Surgery Fellowship. We're in the Tampa Bay area. So, I know time is limited, and I don't want to steal from any of the other guys. I want to keep everybody on schedule. So, let's get into it. So, our program in name is new this year. However, it is a continuation of the former St. Petersburg Innovative Foot and Ankle Surgery Fellowship that was founded by Dr. Adam Perler in 2019. Once again, we transitioned this year. So our program is a well-diverse, mixed collection of podiatrists and an orthopedic surgeon that we work very closely with. Jobs ranging from orthopedic group, private practice, and I myself am currently hospital employed. I used to be orthopedic employed. Our faculty include, in addition to myself, Dr. Odmark, who is our orthopedic foot and ankle surgeon, Dr. Perler, who's still involved with the program, John Constantino, who's a former graduate of the fellowship, and Dr. Daniel Perez, who trained with Dr. Bellis. Unique about our program is we do a yearly medical mission trip to Peru. So that is currently done with Dr. Perler for about a week and a half. You'll go with him. This year was in October. I think it's generally around that same time each year, where you're able to kind of see and do things a little bit differently and get that experience. So once again, we do have prior graduates to the program. It's more of a continuation of a previous program that was up and running. So our current fellow, Dr. Dylan Patel, I believe, is on the call. So as I get through this, I do want to kick it to him at the very end. Hopefully he's listening to maybe share some of his experiences about what we're doing this year. And our incoming fellow is Dr. Christine Gillenwater. So we're excited to have her coming in. So some details about the program. One of the perks is living in the beautiful Tampa Bay area. So weather's pretty nice down here. It's not a bad place to spend a year. Salary is $65,000 plus benefits. You do get a cell phone stipend, which is about $1,200 extra. Appropriate CMEs, PTO, pretty standard stuff there. Expectation for speaking and presenting at SAM conference, which is a local Florida conference, as well as ACFAS. Various fellow courses. I'm a very big proponent of the fellows going to the ones that they want to, with the various companies. Take advantage of the travel, take advantage of seeing different products in the industry. Once again, we mentioned the medical mission trip with Dr. Perler. Opportunity for various consulting and design projects that the attendings are involved with. So a lot of times the fellow will get an opportunity to kind of not only see what we're working with, but help us out with some things. So that's kind of a unique opportunity there. My emphasis is on the business and practice management side of things. Once again, we have attendings who are orthopedic based. We have hospital, private practice. So we spend a lot of time on billing and coding, contracting. I have three lawyers in my family. So when we're looking for jobs, we spend a lot of time going over the nuts and bolts, so to speak, of the contracts, what to look for. And I really take a lot of pride in making sure our fellows come out with a good contract because, as we all know, there's some very bad contracts out there, but there's also some very good ones. So where you start can make a big difference in the overall trajectory of your career. Currently, and as I see it moving forward, there will be no call. So you're not on call. Basically, you show up, you work, and when you're done, your time is your time. I have a young family. I'm very busy with that. So, when we're done, we're done. We work hard, we go home, and then it's your time. General schedule is clinic with me on Monday. Tuesday is surgery with Dr. Odmark, and then added built-in time for research. Wednesday, surgery with myself. Thursday is surgery with Dr. Odmark. Friday is surgery with basically the collective of all the doctors. Friday seems to be a popular day. So those days, usually the fellow will bounce around, kind of pick and choose whatever cases they want to do. And that kind of wraps out the week. So as you can see from the schedule, I do like clinic. I love having the fellow in clinic. It helps me a lot, but the emphasis is more on being in the operating room and also having time to do some separate research. So we do have that built in. That is an emphasis that I'm putting on the program moving forward. I would like to get more involved in that. My background was I did spend 3 years doing bench research at UPMC. So I do have a lot of foundation in research, but as we all know, when we get a little bit busier, it can be a little bit hard to carve that time out. So that is something I'm interested in moving forward. But Dylan, are you on the call? Do you want to speak a little bit more too about the program?
Yeah, definitely on the call. Thank you guys again for allowing us to speak. The program itself, Dr. Troxell kind of overviewed really well. It is a fellow forward, fellow first program. The amount of work you put into is what you're going to get out of it. It definitely gears you up to see a wide range of diversity in terms of big cases, small cases, whatnot, all the way from forefoot, ankle, rear foot, whatever. The Peru trip itself is one of a kind. I would say that when I went on to this year, I took away a lot of the nuances of surgery where if you are in the OR and you don't have things that you typically would have here in the States, you kind of problem manage and problem solve along the way. So that's a kind of a unique experience that you really are put in a situation where things can go wrong pretty easily, but you have to think outside the box to really make sure that your patients get the best care possible. So it's definitely a unique experience. Overall, though, the fellowship, I have nothing that I would say would want to change with the program. The program has everything in terms of you would want in a fellowship overall, and yeah, that's pretty much my spiel with the program. Always open to answer any questions for the future fellows or candidates. Our email is on our FACFAS page. We have a really conclusive video as well that me and Dr. Troxell, made this year that kind of overviews the program in more detail. So feel free to watch that as well.
Good. Well, I think that's all we got.
Fantastic. Does anyone have any questions for Dr. Troxell or Dr. Patel? And if not, I have a question for Dr. Patel. What was your biggest, getting toward the end of fellowship, your biggest takeaway that you're going to be walking out from this fellowship? What's the biggest, I guess, pearl or lesson or value that you're taking away from coming out of fellowship here?
Yeah, I think honestly, the practice management side of things, the biggest thing, surgically speaking, I came from a really good residency program where I was pretty good foundation wise coming into fellowship. I think I learned the few nuances with surgery that I could kind of improve, but more so the practice management side of things, where Dr. Troxell really does go through the nuances with billing and coding, how to run a practice and make sure that you're successful early on in your career and what to look for to really improve your practice. So I think that's the biggest thing that I've taken away thus far and moving forward with my career.
Fantastic. Well, thank you both for joining tonight.
Thanks for having us.
All
Thank you.
right. Next up, we have Dr. Bradley Lamm from Foot and Ankle Deformity Correction Fellowship in West Palm Beach, Florida. Dr. Lamm?
Okay. All right. Can you see my screen there? I'm going to play a quick video here, Lauren.
Perfect.
Foot and Ankle Deformity Correction Fellowship here at the Paley Orthopedic and Spine Institute, housed on the campus of St. Mary's Medical Center, the Palm Beach Children's Hospital. Our fellows will master the surgical skills necessary to perform accurate foot and ankle deformity correction procedures. Treating both children and adults, they will perform not only the most common foot and ankle procedures, but also the very complex. The fellow will also gain surgical experience from a wide range of complex foot and ankle surgery techniques, such as minimally invasive bunion surgery, Charcot foot deformity correction, limb lengthening correction, total ankle joint replacement, and brachymetatarsia, to name a few. The Paley Institute was founded by Dr. Dror Paley. He's a pioneer in limb lengthening and deformity correction surgical techniques. Dr. Paley has handpicked world-renowned surgeons that are experts in their field to join our institute. This provides our fellows a great advantage in being exposed to world-renowned surgeons here at the Paley Institute. Taking part in weekly educational conferences, the fellows will learn about complex deformities and the thought process used to correct them. They learn firsthand the variety of surgical techniques from my partners and myself to further enhance their educational experience. If you're interested in learning more information regarding my unique fellowship, please contact the number below. Thank you.
Okay, and then I have PowerPoint I'm going to bring up here. Let's see, share. So yeah, so my foot and ankle deformity correction fellowship has been in place since 2008, one of the first 10 fellowships recognized by the American College of Foot and Ankle Surgeons. So kind of been around a while, 18 fellows. I've trained or currently training my 18th fellow. So it's something that I take one fellow per year. We do around 500 cases a year. I'm housed at a level one trauma center, one hospital, one surgical center that we operate out of, so you're not driving around. We have 28 partners now in our group, pediatric orthopedists to traumatologists to sports medicine docs all in our group. So a wide variety of exposure to unique techniques that are not done most places due to our kind of limb deformity type center. We do 2 clinics a week, 3 surgery days a week, inpatient, outpatients. 1 call every kind of 2.5 months for the hospital, 1 week a call we take. And then you're kind of taking call as the fellow for my practice, kind of outpatient stuff. Calls come in. Definitely good benefits. I get you loops, I get you lead, I take you to courses that I go to. You get sent to fellow courses, of course, to our annual American College of Foot and Ankle Surgeons meeting. We have you present one of our research projects. That's the goal. And submitting at least a 1 peer review article during your fellowship year. Some fellows have done 2, 3, 5. It depends on the fellow. You get free food at the hospital. That's always a plus for the fellows. We treat children and adult, West Palm Beach. Like Dr. Troxell said, the West Palm or the Florida is a good spot to live as a fellow. We do a lot of regenerative medicine. My partner, Dr. Wynn, who was my previous fellow 3 years ago, does a lot of sports medicine, a lot of regenerative medicine type work. You're part of the Florida Foot and Ankle Fellowship Society. We do kind of monthly conferences amongst the Florida fellows. We've been doing that. I think as a fellow, you're well-rounded because I try to make sure that you have exposure to everything you're going to do when you get out, from forefoot to hindfoot to ankle to external fixation, limb deformity, limb lengthening, marketing, billing, consults in the hospital. So you got to be well versed in all this to be successful in the future. So I make sure that you're doing all this. I kind of have an apprentice model in my fellowship. You're kind of under my thumb, in a good way where, you're learning directly from me. You're not down the road or in a clinic by yourself. You're always getting constant advice, and I think that's really important. The application, basically, just send in your in the kind of new year of your second year. Send in your application. The interviews are usually, kind of early in the year and springtime. I have you kind of spend a day in the operating room, spend a day in the office with me. That way you can kind of get to know us and myself and the program, and then also we get to know you. I think it's important that as a resident, you're a doer, but as a fellow, I'm going to train you to be a thinker and be able to think through things principle based. Make sure you understand kind of everything before you cross the threshold for surgery. So really important to kind of make sure you're, kind of dialed in with your exam, your preoperative evaluation, gait analysis. Radiographic analysis, and also your advanced imaging, and really understand the problem because we treat a lot of complex problems, revision surgeries, and that's important to have a great plan before you go to the OR. We treat significant problems at our center, like this post-polio patient that I treated. We do limb lengthening. This is an internal lengthening rod that we do. And so we have a great group of staff that, is very helpful for your future as a fellow because not only you're learning from me, but my partner, Dr. Wynn, you see on the right, and then also our whole team as well. So, I think my goal as a fellowship director is to train you to, like I said, be a thinker, but learn like I learned in my fellowship that you learn in 1 year what you learned in 3 years of residency. So that way you get kind of really dialed in, not only surgically, but seeing patients in the office and treating them and being, respectful to patients, understanding kind of how to deal with them, how to deal with hospital staff, office staff, and also help you with your future endeavors with connecting you with hopefully a future job down the road, which is very important to me that not only you're well trained, but get a good position for your future. So if you want more information regarding the fellowship, my email is down below, or you could check the ACFAS website, and appreciate your time, and hopefully contact me if you have any questions.
Fantastic. Thank you, Dr. Lamm. Looks like we have one question for you in the chat and throughout the presentations for everyone as well. Does your fellowship accept H-1B fellows or visas?
No, we don't.
Okay. Any other questions for Dr. Lamm? Okay. Well, thank you very much. Next up, we have Dr. Kenneth Hegewald from Orthopedic Sports Medicine Center of Oregon, Foot and Ankle Fellowship.
Thank you. Can you guys hear me?
I hear you great. Thank you.
All right. You guys can see my screen?
Perfect.
Okay, cool. And so thank you for the introduction. I appreciate the college allowing us to share a little bit of our program tonight. And thanks for everybody for tuning in. My name is Ken Hegewald. I am the director of the OSM Foot and Ankle Fellowship. We're based out of Portland/Lake Oswego, Oregon. We're a young program. We're currently matriculating our first fellow through. Her name's Toby Gunter. If you look at OSM, it's comprised of myself and 5 other orthopedic partners, subspecializing in, we have 2 sports medicine surgeons, a spine surgeon, a hand surgeon, and 1 adult reconstructive total joint hip and knee surgeon. We just signed another hip and knee adult reconstruction surgeon, so there will be a total of 7 of us. We collaborate with 2 outside, very busy podiatric surgeons in the Portland community, whom I've handpicked due to the high level of work and volume that they do. Tim Minio is one of them. He's quite active on FACFAS at the regional or national meetings. He has a very busy private practice in the Portland area, does high level quality work. And then Steve Schroeder, who's a very busy sports medicine surgeon at at one of the sports medicine clinics here in Portland. If you look at the fellows volume, it's well over 500 cases a year. Went back and I had my current fellow pull her numbers over just the past 7 months of our program, and she's logged over 353 cases. This, well diversified, layout of cases that we're doing here. Smaller portion of diabetic stuff, large portion of sports medicine. My practice specifically is very trauma based. I would say my practice alone, my surgical volume is probably at least a third ankle trauma, with a third sports medicine, and a third being reconstruction. If you look at her TARs logged in the first 7 months, she's done 26, which is fairly impressive numbers between the three of us. I believe 26 was higher than I did in my fellowship in 2015, doing one of the more prominent fellowships. So high volume, we're fairly busy. This is just showcasing some of the work we do, from sports medicine to fairly complicated trauma. We cover call, our orthopedic providers cover call at two level 2 trauma or 2 level 2 hospitals in Portland. Portland has 2 level 1 trauma centers, and so most of the trauma that we'll get is more elderly fragility fractures. We'll get a lot of the stuff that can be splinted and seen in clinic. But some of the real high velocity stuff typically will be diverted to some of the level 1 centers, but we stay very busy with what we do get. None of my partners have any interest in tackling any of the foot and ankle trauma. And so anything that they feel comfortable, handing over our way, we will do, and we'll try to do obviously the best we can at it. But this keeps us quite busy. This is just showcasing some of the caseload that we do. And then, fairly high volume of complicated reconstruction and total ankle as well. From revisions to total ankle with total talus, and total ankle, staged or done in a single stage with deformity correction. If you look at our current fellow, our first fellow is Toby Gunter. She's from Intermountain. She started with us in August, and she'll be finishing in July. And we're really excited to have Abe Kirian starting in August with us as our second official fellow. We are currently wrapping up the application cycle for the 27 to 28 year. We'll probably be picking a fellow very soon for that year. If you're interested in the program, my advice would be to start the dialogue early. Try to reach out. In your first year, I think is a great time to reach out and start the dialogue process, and consider visiting. Rarely will we accept or consider accepting somebody if they haven't visited. Oftentimes, if you're coming from a large distance, we'll use your visitation as a formal interview, just getting to know you more. I think that's really important. If we look at the fellow schedule, fellow can typically on average expect to be in surgery at least 3 days per week. I think it's really important to have at least one dedicated clinic day so that we can hone in the fellow's clinical skills. But busy weeks, call weeks, weather patterns, we can get all of a sudden very busy, and the fellow could be in surgery 5, 6, sometimes even 7 days out of the week. This is just kind of an average of what they can expect for a schedule here. Fellow will be assisting in orthopedic foot and ankle trauma call. This is fairly low demand. Like I said, a lot of the trauma that we get is cold trauma that gets shipped. Patients that can't be discharged due to the unstable nature of the injury, or they're elderly. They'll typically get admitted, and then we'll go see the patient and fix it on our timeline. The fellow will also be taking one call week out of every 5 with primary podiatry call. This is only at one local Portland hospital. We work at 4 different surgery centers. We try to do most of our volume through the surgery center. I would say it's probably well over 70% of the volume, total surgical volume, is done outpatient basis at the ASCs. We're proud of our new building. We have a 30,000 square foot clinic, newly renovated in Lake Oswego. Amenities include a full body on-site MRI, 2 separate X-ray suites, over 25 exam rooms, in-house PT and OT. This is just kind of a look of what the clinic is like. Here's our full body MRI scanner. It's 0.55 Tesla Freemax. We also have sports team coverage and affiliation. 3 of our providers provide official orthopedic care for the Portland Trail Blazers. This typically involves staffing the home games, and at times they'll also travel with the team. This mid-season gets very busy. We'll oftentimes see these guys coming through. They're constantly getting scanned through the MRI machine, and it's not uncommon for us to be asked to consult and evaluate these patients, these players in the clinic setting. Because of the sports team of professional affiliation, we're the networking of athletic trainers and whatnot. We're also, indirectly oftentimes asked to also consult in some of the college athletes in the area. Mainly that's University of Portland, Portland State. It's not uncommon for us to see their athletes too. We also are only an hour away from Mount Hood, 3-hour drive from Mount Bachelor. And so we see a large percentage of our sports med volume is snow sports. Mount Hood's a sequence of glaciers, and so it offers year-round ski and snowboard training. So that keeps us pretty busy year-round as well. Other perks of Oregon, if you're not familiar with it, it's Portland is 90 minutes from the Oregon coast, which is one of the most beautiful places in the world. 60 minutes from Mount Hood, which is fantastic. And just 30 minutes east, you can get into the Columbia River Gorge, which is also beautiful. Some of the best hiking also in the country here. That's kind of my summary. I encourage you to reach out directly over email. I put my current fellow's email here too, Dr. Gunter, and so I'm sure she'd be happy to take any questions you guys might have. Thank you for your time.
Thank you, Dr. Hegewald. Looks like we have a couple questions in the Q&A for you. Is it too late to visit for this year's cycle?
We have some really strong applications that we're currently deliberating on. I would say it's probably a little late for visitation this year, but we haven't officially chosen somebody yet. And so if our interested candidates fall through, I'm not going to say it's too late necessarily, but interested candidates, for this year would need to stay posted.
Okay. And then same question to you. Do you accept H1 fellows or visas?
I know I've had previous year, I've had some applications even from some foreign MD-DO students that I'm not familiar with that. And so it's not an area that I've really had the time to explore. And so unfortunately, I'm going to say my answer is going to be no right now, but that could change as I educate myself on that and the nuances of that and what that takes.
And then does your program allow for fellows cases where they're logging as primary surgeon for their call cases?
Yes, absolutely. And so, until we see how the fellow surgical skills are developing and assess their comfort range, I anticipate that, early on in the year, that's going to be less, but, as they mature through their year, I certainly hope that that their primary surgeon cases grows, even with some of the more complicated trauma cases even.
Perfect. And to reach out to the audience, I know there's a big question on which cases can be logged towards board qualification certification and which cannot. I would suggest reaching out to the current fellows at each individual program and asking if their cases count for that or not. Typically, for those to count, you do have to be the primary surgeon on them. So whether it's coming from your fellows clinic or call cases. So those are questions that would be really good to reach out to individual programs about. All right. Thank you so much. Moving on, we have Dr. Sandra Raynor at Foot and Ankle Institute Fellowship in Indianapolis, Indiana.
can you hear me?
Hi, how are you?
Hi, doing fine. So let me see if I can share this uh, PowerPoint here. Okay. Okay. Let's see. Can you see that? The
Perfect.
PowerPoint?
Yep.
Okay. Okay. So we're in Indianapolis. We've had I think this is our going into our ninth year of fellowship, and we have two fellows every year. Our group, it's a private practice with 14 podiatrists, everyone board certified or qualified, and 10 offices kind of centered all around Indianapolis, central Indianapolis. And we cover pretty much all the hospitals in the central Indiana area and surgery centers. The driving is not extensive. From one end to the other is about 35 minutes. So there's not a whole lot of driving. There's our physicians that are involved in the practice. So the schedule, the fellows' schedule basically is they're in clinic 8 to 10 hours, and they are running their own clinic. They're not in following a doctor, but they are running their own clinic with their own patients. There are other doctors available in that building to help if they have any questions. They do, to answer some of the questions that came previously, they do get to board their own cases that they can log for their boards, cases that they get through clinic, and also cases on call. There's approximately 7 to 10 days of call each month, and they work very independently, and they are able to board those own cases with help anytime they need help. Cases are roughly between 40 to 50 per month. And we do not double scrub. Almost never are the cases double scrubbed. So when the fellow is in the room, they are almost always doing the entire case. So let's see, we just went through that. And we went through the call and being able to count it for boards. We do, as FACFAS requires, the fellows do poster presentations and then work on a research project. We have a couple things going right now, and are open for the fellow's own interest if they have certain ideas. We do have two labs available in the area, and we have pretty much full access at any time for the fellows to go work in the labs. Very well staffed labs. Let's see. Indianapolis. Well, I guess we're in a flyover state, I hear, but it's actually a really nice city. There's a lot to do, and its traffic is not nearly as bad as it is in some places. We do have the 500 and kind of typical Midwest weather. So we get the winters, but we do have nice springs and summers. And there really is quite a bit to do in this area. So let's see what else we have down here on the PowerPoint. So we went to FACFAS, had a good time in Las Vegas this year, as you can see, and we all went to see the Wizard of Oz in the new Sphere. So, and I have, I believe one fellow's on, maybe both are on. So I don't know if they want to add anything, if they can hear me, if they want to say anything. Patricia or Vikram, are you on?
Yeah, can you hear me?
Yep. Mm-hmm.
Yeah. I think you kind of covered it all. I think even though we have two fellows, we kind of run independently, so I don't see Vikram a lot of the time. It is really nice that we get to board our own cases and use them for boards as well. I think that was pretty important to me. And then Indy may be a flyover state, but it does have a lot to offer. So I know the first time I came here, I was really surprised and I ended up loving it. So I would definitely recommend checking it out.
We have kept several of our fellows. I think we have it's not, I'd have to think 4 or 5 of our fellows have stayed. So I think that's a good, they still like us at the end of the year. So that's probably a good comment. We do, in terms of cases, it's mostly reconstruction. We have a pretty wide variety. We also point out that all our doctors have trained in different locations. We do have 2 graduates from Pittsburgh, but otherwise from West Penn. Otherwise, everyone's trained in different parts of the country, different schools and different residencies. So I think that is a plus because we have a wide variety of the way people like to handle different problems. All our doctors they all like to teach and I think are all very approachable. So the cases, we do not have a lot of trauma. So this is not as like the last program. This program is not heavy on trauma. We do get some, but it's primarily reconstruction all the way along. We have a couple doctors really like to do MIS. We do have quite a few TARs going on and quite a lot of frames. I would say the one area, I think very, very diverse program with the exception of probably not a lot of trauma. We do try to work with the fellows and make sure they understand billing and coding, which as well as just practice management. I think that they have get quite a bit of experience with that. And the fellows that have, whether they've stayed or whether they've moved on to other parts of the country, have been successful and often reach back out for questions. So I think we have a very good mentoring system going. So I guess that's about it. If we can open it to questions, then.
Fantastic. So quick question for you, Dr. Raynor. Same question about, do you accept visas for H1 students?
We do not. We did actually looked into it last year. We had someone that we really wanted to take it. We're not really, because we're not set up as part of a university, the requirements are a little bit difficult for a private practice.
Perfect. And then I do have a question for Patricia if she's still on. A couple of questions that we're getting in the Q&A is, how did you set yourself up during the interview process? How early on were you visiting? What would you suggest to prospective fellows on how to reach out and how to do their due diligence about educating themselves and reaching out to programs?
Ooh, okay. So I actually met Dr. Raynor, I think at FACFAS in my second year, and that's when I kind of met her and got to know her. And then I sent my application in shortly after. I would say kind of like timeline for applying for me, just fellowships was kind of like April, May. And I think the best thing to do really is to kind of find out who the current fellows are and reach out to them, because that's really where you'll get kind of like honest feedback, good answers. I mean, any fellowship is usually a pretty good fellowship, but fellows themselves can kind of tell you their day-to-day life, all the details, what they're experiencing, and kind of why they chose that fellowship specifically.
Perfect. And I agree. The college would say, check with each individual program on application deadline dates. But exactly everything that you did sounds very reasonable. Well, thank you both. Appreciate both of your time tonight. Moving on. Sorry about that.
Sorry, we do have people come visit. We are getting applications in, and basically what Patricia said, we are, people submit their applications and then generally I will call and talk with them and see if they're still interested, and then we will arrange a time for them to come out.
Perfect.
And kind of go from there.
Awesome. Thank you so much.
Thank you.
Okay. Moving on, we have Dr. Lawrence DiDomenico from Reconstructive Rearfoot and Ankle Surgical Fellowship in Youngstown, Ohio.
Thanks, Lauren. Appreciate the time. I'm gonna have a little PowerPoint, and I think my fellow Alex and I may be on too. Can you see my screen?
Perfect.
Yeah, great. Thanks. So, Yeah, our fellowship's been around for a while. Um, we started our fellowship years before I think ACFS started having it. So we've been doing this for about 21 years now, I think 22 years right now. So anyway, here's a list of the previous fellows, and here's the staff on our practice. It's a private practice, I think the large multi-specialty group in there. And we go to like about 5 different facilities, mostly 2 main ones, and then we go to some other hospitals around the area. Downside of our program, we're spread out quite a bit, so that is a negative, but the variety is pretty good from the type of care that or pathology that we see. We have really 2 basic clinics, really one in Boardman and one in East Liverpool, and then we go to one in Youngstown part-time and one in Columbiana part-time. So, but the real 2 main ones, workhorses are the two first, Boardman and East Liverpool. Here's a photo of some of my older fellows. It's for one position. It's for 1 year long. Starts August 1st, ends July 31st. The application's through ACFS. Our stipend's 60,000. We usually give a bonus to every year to our fellows. It's in Youngstown, Ohio. Not the greatest area, but it's a great year to really dive in and spend really trying to learn your craft as your profession. Our clinic basically is a half day in surgery in the morning and a clinic in the afternoon on Monday. Tuesday's a full day clinic. Wednesday's a half day surgery, half day clinic. Thursday, full day clinic, and Friday, typically mostly surgery most of the time. And Saturday, over the years, I've had some fellows say they want to have a fellows clinic. So we started a fellows clinic on Saturday morning for them, and then they can round after that and or Sunday if they need to, based on what our issues are. So we see a lot of diabetics, a lot of diabetic limb salvage, a lot of reconstruction, whether it's simple stuff or more complex stuff. We also participate in a lot of diabetic studies as well. In more recent years, minimally invasive bunion surgery has grown. We've jumped on and participated with minimally invasive bunion surgeries. I've been doing the percutaneous calcaneal displacement osteotomy about 25 years. So try to minimize a lot of scar tissue and procedures in that way. Obviously, total ankles, when the appropriate indications come. I've used a variety of total ankles over the years. Do a lot of flat foot reconstructions, cavus reconstructions, and really, like I said, complex diabetic limb salvage. I really don't like amputating. We do, or I do if we need to, but I think most of these limbs can be salvaged at the right times. A lot of the things I learned in my training was muscle tendon balancing as well as a bony work. So you'll see a lot of muscle tendon balancing with this. And then from a wound care standpoint, skin grafting, rotational grafts, maybe some muscle transfers, whatever it may need. And we do get a fair share of trauma cases, and then obviously infection cases in through the hospitals. We also have a cadaver lab. Try to utilize that for teaching and for some labs for specialty things that the fellow may want to learn from. Program overviews, typical foot and ankle. We do about 300 to 400 cases a year based on what's going on, maybe sometimes a little more. Try to be involved, engage with their fellow, try to teach them the things I've learned over the years. I feel like I've been very fortunate. I learned from both podiatric surgeons and orthopedic foot and ankle folks, so I feel like I could share the best of both worlds, if you will, from that and share that information. So I like to stick to mostly AO basic trauma and reconstructive surgeries when we're doing them. I really like doing the salvage procedures. I think they're very rewarding because I think a lot of people in our profession in orthopedics don't really give enough attention to these patients. They're difficult to manage, and I try to guide you through that. I participate in a lot of medical mail, so I try to tell you where to stay away from and what to do and what not to do because it's a dangerous area to be in. And then your basic yuppie bunion, hammer toe stuff, pretty simple things, whether it's classic Lapidus or MIS or whatever it is. I love doing it. I think it's very predictable. You can go into surgeries feeling very confident when you come out. And the big thing, I'm about earlier weight bearing the same day at Lapidus, weight bearing the same day doing an MIS surgery. And even with our more aggressive reconstructions, try to get them up and moving sooner than later. And again, our total ankles as well, a number of varieties. I like doing a lateral approach. I'm probably a minority in most. I like that Zimmer total ankle. I think it really provides a great implant, but there are other ones that we use as well. And then X-Fix and then internal fixation when needed for fracture care or management, whatever we have to do, we will try to do. But I'm a traditionalist for the most part. And now and then we'll do the nerve decompressions. I got to train with Lee Dallin and the diabetic peripheral neuropathy and or entrapments. Try to deal with those patients as well. So a little variety of all types of complexities from foot and ankle. And really what makes a difference is really, I think, just focusing on the basics, the fundamentals of surgery is what I try to really stick to. So if you have questions, here's my email address. Alex is, I think, online. If you have questions, she can answer. Here's her email too. Her dad's a program director in Buffalo, New York. So I think it's a nice variety of complementary mindsets going into this. Thank you.
I am online, and that is my correct email if anyone has questions for me too.
Awesome. Well, thank you both. Anyone have any questions for Dr. DiDomenico or Alex? Okay. Alex, I have a question for you if you're still on.
Sure.
What has been your biggest takeaway of fellowship so far, biggest pearl or value that you think you've learned coming toward the end of fellowship that you'll take away early on in your practice?
I think the biggest thing that I've learned is that there's a lot of ways to do and treat different pathologies. So, like Dr. DiDomenico said, he really focuses on the fundamentals and getting behind why something is happening. So I think that's something that I've really taken away from this year is really diving into not just how to fix a problem, but what is causing the problem, how to get to how to fix it, and then what's going to work for each individual patient based off of what's going on for them. And I think that's been a really great thing that I've learned this year to take away.
Fantastic. And then Dr. DiDomenico, same question for you. Does your program accept visas?
No, we do not. I'm sorry. We're a private practice, so we cannot.
Sounds good. Any other questions? Looks like we're good. Well, thank you both for joining tonight.
Thank you.
Moving on, we have Dr. Michael Dujela at Olympia Orthopedic Associates Advanced Reconstructive Foot and Ankle Surgery Fellowship.
Hello, can you hear me, Lamm?
Hey, how are you? Yes, I can hear you
Good,
perfectly.
yeah. I am Dr. Dujela's fellow, Lee, so I will send a request to share my screen, and then I've got a PowerPoint I can pull up and go through.
Sounds great. Thanks, Lee.
Can you hear me?
Yep.
Oh, there we go. I think I thought I cut out for a second. Let me see. All right. All right. So, yeah, as I mentioned before, my name is Lee. I am the fellow that worked with Dr. Dujela at Olympia Orthopedic Associates in our fellowship program. A little bit about us and our purpose. So overall, our goal as a program is to provide the fellow with a unique and educational, as well as a well-rounded training and surgical experience, with a particular emphasis on orthopedic, reconstructive foot and ankle surgery. So we're located out in Western Washington, about an hour and a half south of Seattle, and about an hour and a half north of Portland. And the state capital, Olympia, is right exactly where we're practiced. We're primarily maybe 20 or 30 minutes south, but we have satellite offices just inside of Olympia as well. That picture doesn't seem to translate, but we were unfortunately the victims of a flood probably about a year and a half ago, which meant the good news being that we were able to renovate the entire clinic and facility. So that's meant brand new kind of clinic setting, treatment rooms, and yeah, totally renovated area, which has been very nice. I think the previous fellow, Joey, maybe caught the tail end of it, but we've kind of since transitioned back into it entirely for my year, which has been super nice. Let's see. Oh, there it is. Yeah, so that is just the entryway. A little bit about Dr. Dujela. He's obviously our program director. So, very well established, in, the field and, in, foot and ankle surgery as a whole, both nationally and internationally, having completed several orthopedic fellowships, particularly at OFA, as well as several international ones in Switzerland and Germany. He was the head of the AO Trauma North America Foot and Ankle courses, as well as having recently been the chair of the ACFAS conference. And I think this is actually now he's the president, no longer president-elect of ABFAS. So, that's, I think, a real highlight of our program is working with somebody very closely who's just so well established and has, all of those types of background and experiences. Some of our other faculty, this is our list. The two other ones that we primarily work with outside of Dr. Dujela are those at the top, Dr. Lamm and Dr. McLeod. Dr. Lamm is an orthopedic trained foot and ankle surgeon. He also has background in sports medicine as well. I think he's dual fellowship trained. And then Dr. McLeod is a fellowship trained podiatrist that's out in Longview, which is just a bit south of us. But amongst both of them, they see a lot of your, I believe Dr. McLeod is in an orthopedic practice as well. So amongst them two, we get our handful and fair share of reconstruction and trauma and sports medicine, which is great. The other attendings, Dr. Burchard, Bender, Hawkins, and Harvey, they're all orthopedic surgeons within the practice in our Centralia division, and they do their various shares of hips, knees, shoulders, and sports medicine. And so, when we have any sorts of downtime, to get our hands a little bit dirty and some more exposure, they're all more than willing to kind of let us scrub their cases and get some exposure, which is great for just general ortho as well. So some of the positions details. So we are a one-year program. What I like about our program, which I thought particularly helpful, was we start actually July 15th and then end on the 31st. So there's essentially a 2-week overlap between the previous and the current fellow, which is really good for kind of, getting the ball rolling and kind of that initiation process. So that way you can kind of really, like I said, hit the ground running when it comes to the start of your official year when the previous fellow is gone. And then we accept applications up until around May 1st or so. So our compensation, so we have a salary of $60,000 with our CME allowance, and then of course we allow for vacation and sick leave as well. There's also dedicated time allotted for fellowship courses, which I think the previous fellow, and I'm on track for about 4 or 5 this year, as well as major conferences and a handful of cadaveric labs to get a little bit of hands-on training with specific companies. Research, so obviously ACFAS has the kind of standard requirements. I think this year had several posters, and then in the past few years I've had a few honorable mentions and manuscripts as well. So the expectation is certainly something publishable, as well as certainly something for ACFAS. But we also try to generate multiple scholarly research projects throughout the year. Cases, so we see approximately about 450 or so, with about 850 total procedures, and the bulk majority of them being rear foot and ankle. We see a large amount of trauma. We're right next to our hospital, so we get a lot of referrals from them. And then on the clinical side of things, we see probably about 5,000 patients a year. So, a good balance between surgery and clinic for sure, with a fair number of days being fellow-led. Some of our unique features, so, being integrated in a busy orthopedic practice is certainly great exposure, which I know I didn't have much of directly in residency. This allows you to get a little bit of experience in not only just how to run the practice and the day-to-day and ins and outs, but various business strategies, fundamentals, and overall practice management. As you stated, we have multiple kind of fellowship trained foot and ankle surgeons, as well as board certified orthopedists and traumatologists to all get that, great exposure. And then we also have that unique opportunity with Dr. Dujela having done, international fellowships that is an opportunity, afforded to the fellow as much as they'd like to kind of pursue it. So these are just a couple of pictures of the previous fellows at ACFAS, I think last year and this year. But yeah, that is my contact information, and yeah, very much willing to answer any questions if they have come up.
Fantastic. Thank you, Lee. Appreciate it. Does anyone have any questions for Lee? I have a couple questions for you. Tell me a little bit more about your day-to-day. A popular question that we've been getting tonight are any of your cases eligible for board certification? Are you in fellows clinic? And if so, about how many? And are you using your cases for that?
Yeah, good questions. Yeah, we do have the opportunity for the fellow to kind of document their own cases. It's a little bit on a more limited basis. You know, most of the reconstructive cases we're dealing with our attendings. We do take call for about once every 8 weeks, where that's a little bit more of traditional, infectious sort of cases. And those we operate independently, and those can be used for boards purposes and logging. It's a little bit limited in that sense, but there is certainly still an opportunity to at least start logging cases. And then from a day-to-day perspective, it's a bit variable. Dr. Dujela is very flexible in kind of making it very fellow-oriented experience. So, between our three main attendings, there's often a lot of, great cases going on, and he's very much willing to accommodate to allow you to go to, say, whatever it is, total ankle or triples or what have you, if it conflicts with clinic, with our joint clinic day. And then other than that, there's not a, specific fellow run clinic as of right now. I think that's potentially something that's in the works. There are a few days where Dr. Dujela may travel for a conference, and, they'll give us a full day of patients for that. Definitely get our fair share of independent experience. But it's not, a dedicated format right now. It's something that I think we're still working on a bit.
Yeah, if I could just interject, that's, as we've merged, that's with this new group, that's certainly something that's happening. It's just a couple months out. But, we pride ourselves on trying to teach. And thus far, I think all of our fellows who've gone out, that's one of the things that they've said has been most helpful is the fact that we work together. It's not just a matter of sending you out in the wild for the year. You get plenty of opportunity to get comfortable on your own, but we work through every single patient together, and it's a rationale, like, why are we doing what we're doing, and trying to impart good habits, and re-educate on different ways of doing things. I think that most of them come out and they're extremely comfortable. In fact, all of them have said it's incredible when they hit the ground. There was just no nerves. They were just absolutely ready to go. And I think that's the beauty of what fellowship really is. Not everybody needs a fellowship. I think some people come out and they feel really comfortable and they're ready to go. Other people need that other year of seasoning. But I think for me personally, if I'd had an opportunity equal to what we're giving right now, it would have made my life a lot easier right out of the gate.
Perfect. Any other questions for Dr. Dujela or Lee? Okay, well, thank you both for joining tonight. Really appreciate it.
You
Thank
bet.
you, guys.
Thank you for having
Appreciate
us. A pleasure.
Next up, we have Dr. Mark Hofbauer at West Virginia University Medicine Wheeling Hospital Foot and Ankle Advanced Surgical Fellowship.
Hey, Lauren, this is Devin. I'm the current fellow with Dr. Hofbauer, so I'm going to be presenting on his behalf for WVU.
Sounds great. Thanks, Devin.
Yep. Let's see if I can get my this to share. All right. All right. Can everybody see my screen?
Perfect.
All right. So, like Warren said, I'm the current fellow at WVU Medicine in Wheeling Hospital, the Foot and Ankle Advanced Surgical Fellowship, with Dr. Mark Hofbauer as the director. My contact information is on this first page. So if anybody wants to kind of reach out and ask any other questions, this will be recorded for posterity. Kind of program overview and kind of summary. So fellow duty includes OR, clinic, and then rounding. Currently with the residents. There's 2 residents a year. I kind of split call duties with them. So, inpatient list for us is pretty mild. So rounding when needed. At this point, approximately 500 to 550 cases at the end of the year. I think I'm on pace to kind of hit that same number this year, and that's kind of what it's been previously. Opportunity to work with 7+ podiatric and orthopedic surgeons. So we have, our core faculty of 7 DPMs, and then we have 2 trauma surgeons that work here at the hospital in Wheeling, West Virginia. We have weekly academics on Thursday in the morning, and this is run concurrently with the residency program. So it's kind of a combination of their didactic schedule plus radiology rounds, M&M, etc. As far as cases or conferences attended or courses, Dr. Hofbauer has really been awesome about letting us kind of go to the courses, the fellows courses that we need to. He goes to SLES in Seattle every year, ACFAS, and kind of lets us kind of choose our own adventure in that degree. He's open to trying to better ourselves as fellows and trying to make the most out of this year for all of us. So he's kind of encourages us all to kind of go to the courses or conferences that we see fit for. Like I said, call split between the residents and the fellows. I think as we move forward and get a full complement of residents here at the hospital, the call burden from a fellow standpoint will be less, just because you'll have 6 residents to kind of cover most of that call. So some of it will be mainly backup call from that standpoint. But like I said, call is not exhausting by any means, just due to the population, kind of the area that we're in. Program emphasis for Dr. Hofbauer and kind of the other attendings is mainly sports injuries, trauma, elective surgery, forefoot, midfoot, or rear foot, Charcot reconstruction, and revision surgery. I think we have the beauty here of having, Dr. Burns as an attending, Dr. Manway, Dr. Hofbauer, is you kind of have multiple people in different realms of podiatry. So you kind of have Dr. Hofbauer, who's more kind of in tune to the trauma and revisional surgery, versus Dr. Burns, who's kind of covering those things as well as really hitting heavy the Charcot reconstruction. Our fellowship cycle goes from August 1 to July 31st. And generally, like even what I did this year came about a week early. So there was a little bit of coverage and kind of handoff from the previous fellows to, my year of fellowship. Current salary is $85,000 a year, which is really nice, especially in this area, because it is pretty affordable. Like I said, faculty-wise, we have kind of 7 core faculty, with Dr. Hofbauer being the fellowship director. You also work really closely with Dr. Burns, who's the residency director, Dr. Bradshaw, who's the assistant residency director, Dr. Johnson, Dr. Manway, Dr. Mansager, and Dr. Pikowski. Dr. Pikowski kind of does more of the kind of inpatient work, and so you get days with him to kind of cover some of those cases as well. And Dr. Mansager is kind of our newest attending, who comes by way of us from Georgetown and fellowship. So where we're located is kind of the northern panhandle of West Virginia. We're about an hour and 15 kind of southwest of Pittsburgh. It's right along the Ohio River, about 27,000 patient population. But we're kind of in the middle of this, where there's not really any big medical hubs between kind of Columbus and Pittsburgh. So we kind of get this unique, position where we're kind of a catch-all between those 2 cities. And so we see quite a high volume of kind of surgical candidates and people coming to be treated, in the WVU system. WVU as a whole is really supportive of kind of the program, whether that's the fellowship or the residency. It's kind of been a really good maker for us as far as seeing the different types of patients and kind of different types of cases and things like that. These are just a couple pictures kind of what downtown looks like. Kind of blue collar city, a lot of coal mining and oil field kind of jobs around this area. So that kind of is reflective in the patient population. These are just kind of an area, kind of overmap of the hospital and clinic locations that we cover. So Wheeling, kind of in the middle there, is kind of our main hub. And then kind of just to the south of there, kind of in Moundsville or Glendale, is kind of the city where another one of our hospitals are kind of the 2 main facilities that we operate out of. But you can see we kind of stretch into Pennsylvania with the Uniontown Hospital, and kind of have a couple other satellite, more rural hospitals in the New Martinsville, Barnesville, Cadiz. And just recently, WVU had acquired Weirton Hospital, kind of about an hour, 45 minutes to an hour north of Wheeling, that at some point here in the near future, we will also be covering from a case and surgery standpoint. Typical schedule for us is kind of a mix between clinic and OR. I would say kind of on average, I'm in the OR 4 to 4.5 or 4.5 days a week. And that's just kind of a mix between kind of what Dr. Hofbauer, Dr. Burns, Dr. Manway, and all the other attendings kind of have going on. Um, and then Thursday is really the only day kind of that it's a dedicated kind of clinic day on from my standpoint as the fellow. You know, we have AM academics in the morning with the residents, and then Dr. Hofbauer and Dr. Burns both have clinic here in Wheeling. So I get to come up here and kind of bounce between both of their clinics and kind of use that as kind of a place that I can kind of work on my clinical skills. We also had the opportunity to work with Dr. Tarkin, who came to WVU from UPMC. Is kind of pretty heavy hitter in the trauma world. Any of the lower extremity stuff that he's got going on, we have the ability to go scrub with him on certain days as well. This is just kind of a snapshot of what kind of the schedule. My job as the fellow is to kind of make the schedule for everybody each week. And this is just kind of what it's looked like the last couple of weeks. So, you know, you can see on here, we're pretty full with number of cases and being in the OR kind of almost every day. So 4 to 5 days out of the week, I'm kind of in the OR scrubbing with one of the attendings, whether that's Dr. Hofbauer, Dr. Burns, or whoever. For us, application deadline is April 1st, and we encourage early applicants just due to the competitive nature of the program. After kind of the April 1st deadline, we kind of have virtual rolling interviews, and then our selected group, our kind of top 10, get a in-person second interview to come to Wheeling and kind of see what the city and area looks like. And then we kind of go from there as far as what that interview process looks like. What kind of Dr. Hofbauer kind of looks for in an ideal candidate is somebody with a strong surgical background, somebody who's a team player, has the 3 A's, so availability, affability, and ability, is very detail oriented. Out and be leaders in the field. You know, they want, you know, as great as great it is to go out and kind of, you know, go and work in a job. They want people and they're looking for somebody to kind of go out and kind of make moves and push podiatry forward. Some of our program strengths, I think are our core faculty. You know, we've all over the board. And I think that reflects in kind of the training and the teaching that you get here with them. That goes hand in hand with the mentorship. I think having, you know, Dr. Hofbauer, Dr. Burns, Dr. Manway, and all the other attendings like numbers in my phone is a great resource for me in the future and for any fellow that kind of comes through the program. Like I said earlier, WVU has started a residency program. So we've got 2 first years that I'm with this year, and we'll be adding, you know, more 2 per year, hopefully for the foreseeable future. So part of your job as the fellow is to kind of train them, and you kind of work hand in hand when they're on the podiatry service. And I think that's a great benefit as the fellow to kind of, you know, you so many times in the OR just trying to absorb so much information that it gives you an opportunity to kind of relay that to somebody who's kind of just starting out and kind of going through that. So I think that's a great opportunity as a fellow that may not be at other programs. And I think just our strength is just being well-rounded. You know, we kind of getting a pretty good variety of different things here from trauma, recon, Charco. So you kind of really get to see it all from that standpoint. So, all right. Any questions?
See. Is it too late to visit for this year's cycle?
At this point, yes, only because Dr. Hofbauer and I have some travel coming up, and so we won't be here. And with the application cycle ending for us on April 1st, we're kind of running into, you know, a time crunch from that standpoint. So we've got some really good candidates kind of lined up for the next couple of weeks to come out and visit. But at this stage, I think for people coming to visit for this coming cycle, it's probably a little late.
Perfect. And then final question for you. I used to get asked this question a lot, particularly with fellowships that work with residencies.
Yep.
As a person that went to a residency associated with a fellowship, I always thought it was great because iron sharpens iron. You're working together, building that camaraderie. There's ways to learn different things about it, but I think your program does it very well. What has your experience been working with a residency, and how has it affected your fellowship?
Yeah, so far, I think I only see that as a benefit. I think so often that you kind of, you know, and I had this, I think, as a third year in residency where you're just, in your zone, you're with the attending, and you're just trying to absorb as much information as possible. And I think when you get on that flip side, you kind of get to treat, what I've kind of taken from this is I get to treat my time in the OR, like with Dr. Hofbauer or Dr. Burns, and you're with the residents, they kind of take a step back and let you be the attending in a sense. So then I'm kind of going through like, all right, how do I relay this information that I know in my mind? When I'm doing the case, how do I tell a first year how to do that and how to go through that? And I think that gives you a little bit better understanding of either what the procedure are, how do I explain this? Because at some point, all of us are going to have people in the room, whether that's scrub techs, other residents, other attendings, whoever, that may not understand exactly what you're doing. And I think being able to kind of go through that through fellowship year and kind of hone that out and kind of tease that out a little bit and figure out how your style of teaching is very valuable. So I don't think it takes anything away from the fellowship, and I think that's a bonus for us having the residents around.
Fantastic. Well, thank you, Devin. Appreciate it.
Yeah, thank you.
All right. So next up, we have Dr. Craig Kamasta at Pediatric Adult Foot and Ankle Surgical Fellowship in Atlanta, Georgia.
Can you all see me? Can you hear me?
Yes.
All right. Good evening, everyone. I'm not going to do a presentation with PowerPoint. I'm a bit tired of those, but most of the information that you would need to find regarding our fellowship is obviously on the website. But I'll talk to you about our fellowship, which has been continuously running for the last 15 years. And before that, I've trained at least over 150 residents out of the North Lake Decatur residency program in Atlanta, Georgia. So that's where we're located, in the northwest corner of Atlanta, Georgia, and which is a great place to live and to enjoy a city and a culture and weather that we can't really beat. We're having 80-degree weather this week, so our fellows get time to go out and enjoy the better parts of Atlanta. So again, we've been doing our fellowship for the past 15 years, and it's primarily an experience with me, and that's could be the good and the bad and the ugly. But my fellows do have the opportunity to work with other attending physicians in surgery for the most part. So, but it's probably 90% interaction with me on a one-to-one basis every single day for a year. So really what I'm looking for in a fellow is somebody that can put up with me and deal with a one-on-one relationship. But it's worked out quite well over the years. So I'll just talk about the program and what we cover as far as our workflow and all that. So we are into doing research projects and publications and lectures. This year, we were the #1 scientific poster presentation at FACFAS. So we just won that award. And we published an article in JFAS just in January this year, I think is the largest and longest term follow-up of primary plantar plate repairs, looking at over 200 patients with an average of more than 4-year follow-up. And some of these go out 15 to 20 years. So one of the things is that I've been in practice for 35 years. So it won't be unusual for my fellows to encounter patients that we've operated on 10, 15, 20, or 25 years later to see the true effects of what we're able to produce. So what I can really offer that's unique is that follow through, because I've been in one location for my entire career. So I'll have patients come back with their kids or their grandkids, and we have a lot of follow through and long-term follow-ups that I think is rather unique. We are a referral base for most of the Southeast states in and around Georgia. So we see patients from all the contiguous states for reconstructive surgery. So in the name, our fellowship is a pediatric and adult reconstructive foot and ankle surgery fellowship. So that's what we focus on. Unique to our program, I think, is that we have a fair bit of pediatric experience that you may not get in other programs. About 20% of our surgical patients are pediatric. And with regards to the type of patients that we're seeing, we're doing about at least 50% to 2/3 of our patients are revisions. So we really follow up on the cases that have had, sometimes we're the 4th or the 5th surgeon. And we have sort of a philosophy that when the next surgery has got to be the last surgery, this is what we're going to focus on. And that largely leads us down the pathway of doing fusions. So we're basically a fellowship where you're going to learn to do fusions and revisions with all the incorporation of bone graft and whatever hardware and software that's necessary. So think about revision surgery, and that leads you into the realm of fusions. Our case flow and all, we don't really take any call. We don't see patients in consultation. We don't have ER call. Everything comes through the front door in our office. And we have basically two kinds of patients, those that we operated on or those that we're going to operate on. So we don't treat wounds except for the ones that we may have created. But we have a network of other practices and offices. I'm part of Upper Line Health. So we have about 40 locations in Atlanta. So we have doctors within our group that will handle taking care of the wounds until that patient's ready for their reconstruction. With regards to the adults, this covers the gamut from adult to pediatric flat feet, a lot of arthritis, cavus foot, flat foot, neuromuscular disorders. The pediatric flow is largely flat feet, and we specialize in coalitions, which I've written multiple papers on, published for treating coalition patients. We see a lot of strange congenital things, clawfoot deformities, polydactylies, macrodactylies. So it really is a broad experience for the pediatric. But my fellows are going to know how to do the generic pediatric flat foot reconstruction when they're finished. And they're gonna own these procedures to do the majority of things, including juvenile bunions. But my fellows are graduating with a lot of confidence that they can handle the majority of things, even some revision club feet. We even see some neonatal club feet patients as well. We do some reconstructive work on the Charcot patients, but we're not the ones taking care of the wounds. So when they can demonstrate that they're well enough to go through a reconstructive procedure, then we will take them on. So we do maybe one of those every month on average, Charcot recon. And these obviously include from toes to tibia. We all know about these patients and their demographics and their high risk nature. But we see a lot of patients that when they come in, they're like, "Oh, doc, everyone else said just do a below-knee amputation." So that sort of gives us the gamut and the leeway and the freedom to be able to do some aggressive surgeries with intramedullary nailing and a lot of bone grafting. We see a fair bit of neuromuscular deformities, and what I really like to focus on with my fellows is deformity assessment. We're going to break down each of these patients individually. We're going to talk about them in front of them and go through the exam. I'll sit my fellow down into the examination chair. All right, hold on to this, feel this, look at that, let's watch them walk down the hall. We'll do some post padding, see how that patient responds to some of the things that we can do to test them in the office. We'll get down on our hands and knees and move the foot around and manipulate it and see what's going to work for that particular patient. And one of the things I focus on is really, I'm going to teach my fellows technique, not really technology. I'll teach you how to fix anything and everything with nothing. From the highest degree of complexity of hardware down to K-wires. And when my fellows are graduating, they are very comfortable in treating a variety of conditions that don't require a lot of technology. And that largely reflects my experience doing mission work in third world countries over the last 30 years. We have the workflow is pretty consistent, that we see patients Monday through Friday. We have surgery every morning, Monday through Friday. So we'll do 1, 2, or 3 cases each morning. And then Monday through Thursday, we'll go to the clinic in the afternoon. And on Fridays, we're going to stay in surgery all day till we're done. So it's 5 mornings in surgery. Fridays tend to be a little bit longer. That's our day to finish up through all these cases. We have fellows that are graduates that have been in a variety of different work environments when they finish up with us. One of my fellows is the department chair at a podiatry school. She's the chairman of the Department of Surgery. Some of my fellows work into private practice, and a lot of them get hired up by hospital systems. So if it pretty much covers the gamut from California to Massachusetts, where my fellows have ended up. One of the things I try to do is simplify what you've learned in your previous 7 years of podiatry school and then residency. And I tell fellows, I'm going to take your brain and eliminate 85% of all the things that you know, and I'm going to show you how to do the 15% and how to do it right and consistent and be comfortable with it. So we're going to take each individual condition. You're going to know a dozen different ways of fixing it. I'm going to show you the consistent way that's going to fix it and why. So it's very hands-on, one-on-one experience with someone who has more than 35 years of experience. And we are sort of family-oriented. My fellows know all my children on a first-name basis, and they ask about each other, and they still follow up, and I'm getting pictures continuously from my fellows and their families and their kids. So this is an ongoing relationship that we have that is really a family-oriented kind of a situation. All my fellows walk in my back door, never through the front door of my house. And I'll be willing to accept any questions at this time.
Fantastic. Thank you, Dr. Kamasta. Any questions for him?
And I can give you contact information with my current fellows and past fellows, of course, they're the best ones to talk to.
Perfect. And we'll make sure that we send that out with our email post communications afterwards. It does look like we have one here. Does your fellowship accept visas?
We're in a private practice, I think, like you've heard from a variety of other presenters. So no, we do not accept foreign visas.
Perfect. Well, thank you for taking the time with us tonight. Appreciate it.
Thank you all. Have a good evening.
You as well. All right. So moving on, we are going to go to Dr. Michael Subik at North Jersey Reconstructive Foot and Ankle Fellowship in Lyndhurst, New Jersey.
Hey, I'm Dr. Subik's fellow. I'm Zach. I do have a little PowerPoint I could share real quick. Let me see.
Perfect. Thanks, Zach.
All right. Can you see my screen?
Yep.
All right. So the fellowship I'm at with Dr. Subik, it's in North Jersey, Passaic at St. Mary's Hospital. We work out of a couple of hospitals. We work out of St. Mary's. We also go to Denville and Dover, which are part of like the Prime Health system with St. Mary's. And then I also take call at Hackensack with Dr. Subik and Dr. Saleh, our co-director. All right. So that's again just general information. In terms of education, we do frequent labs. We do have a cadaver lab on the premises that we have 24/7 access to, which is super nice to kind of go through surgeries that are planned for the week, or if you want to work through a certain dissection. And then obviously we're associated with a residency program, so it's very nice to have them to kind of bounce ideas off of, and they come to you for help, and quite honestly with you, I go to them all the time for help as well. Some of you may know that we do have a very popular grand round, so it's nice to have that in the back pocket. Sometimes the fellow is able to join. It's open to everyone. The residents work very hard on it, so it's again a great resource to have. We do a ton of research, so a range of research from Charcot, trauma, diabetic limb salvage. We've had some great papers that were published in the past, and we have a bunch of papers that we're working with or working on currently as well. All right, and like I said, we have 24/7 access to the cadaver labs. We do have a call room if needed. Most of the time, the fellow doesn't have to stay at the hospital. The residents, unfortunately, do spend some time there overnight, but luckily for the fellow, that's usually something that they kindly take care of. All food and meals at the hospital is free for the fellow, which is super nice if you find yourself there early in the morning or late at night. This is Dr. Subik, the director. So he's the residency director as well as the fellowship director. He also serves as the chief of medical staff at St. Mary's Hospital. And like I was saying, we have a bunch of workshops that we do with the residents that range from cadaver labs to external fixation. We have a great support system from a lot of our reps in the area, so they're always very welcoming to have us out and to their premises to work on or work with any of the hardware that they have. Each year, we also do a little bit of a fellows course. We also have a student workshop. This is kind of spearheaded by the residents and the fellow. So we get together with some of our local companies and go over like complex techniques. We bring in speakers that lecture us on Charcot, external fixation, total ankles, kind of a range of different um, topics that we really hear from the experts in the field. And then this is kind of just the range of cases that you see, anything from like complex external fixation cases with Alizaroff frames or kind of hybrid X fixes. We do a ton of tibial bone transports, which are kind of becoming more popular in the diabetic limb salvage field. And then kind of your bread and butter trauma cases from pilons, open ankle fractures. We have a great variety here. I think that's something that is very nice about our program. It is a ton of diabetic limb salvage, but we take all foot and ankle trauma that comes through the ER. We have a great orthopedic surgeon at the hospital as well. So anytime that you're kind of fulfill your podiatry duties, if there's like a tibial shaft fracture or a knee case or a hand case you want to scrub, then you're more than welcome to. Um, that's about it. I mean, if you have any other questions, I'm happy to answer them. I got my email here at the end. You can always reach out. I'm always willing to talk about the program and kind of go over anything you may have questions about.
Hey Zach, it's Mike Subik.
Hey.
So hey everybody. So just to kind of cap off what Dr. Corwick said, it's a program that we're now in our 11th, I think 11th fellow, and the program itself has evolved over the years. Now I'm part of the hospital practice, and with that we take as much call as we want to. We get carte blanche on a lot of referrals. We run a clinic, a fellows clinic. We have a wound care clinic, so you have autonomy on cases after about the first 6 months. The idea is to create a well-rounded podiatrist who does massive limb salvage and recon. So you are capable of doing most trauma cases that come in the door from day one. And obviously, when you're done, you become a master of that. But also, I teach you how to navigate the world of key opinion leader work too, to get you involved with companies. And also on top of that, medical legally, how to keep you guys out of trouble. I do a lot of defense work for podiatrists across the country, and that's part of the program too. So when you leave, you're getting a practice management education as well as significant education on trauma, ankle replacement. Were indicated, and a lot of limb salvage cases that are referred to us from hours away, not just locally, but they'll drive hours. So you'll get the full gamut of limb salvage, but you'll have the additional aspect of practice management, which is really incredibly important nowadays, and gives you an opportunity to make another pillar of your investment of your education. So we could show pictures. I mean, I've been impressed with the X-rays that I've seen. Mine are no different. They're reconstructive cases, and there's transverse bone transport cases and nerve cases. I mean, you've seen it all. But if you want the full package of hospital practice, a private practice, as well as practice management in North Jersey, this is a pretty substantial program. And our fellows, when they leave, they typically have a program of their own or a job of their own before the first 6 months. And they're pretty involved with education as well. So if you have any questions, feel free to contact us and come visit. But thanks a lot.
Great. Thank you, Dr. Supik and Zach. Any questions from the audience? Okay. Well, thank you all for joining tonight. Just as a reminder, this will all be posted on the American College of Foot and Ankle Fellowship website. Additionally, we will have 2 more fellowship Zoom rooms, Thursday the 12th and then Tuesday the 17th. Look out for email after this Zoom room for further information that will have current fellows' emails on there if any of you have any questions or concerns about individual fellowships. Hope you all have a great night.
Thank you for putting this on. I appreciate everybody.
Thank you.